Welcome to another episode of Synergy Speaks. I'm Bushra. Today I'm joined again by Jack Marrano, Director of Signature Prosthetics and Advanced Restorative Team at Absolute Dental. Jack, thanks again for joining me today.
No problem, Bushra. I am happy to be here.
Awesome. So last time we talked about how navigation synergy plays such an important role in the final restorative process and how we could predictably restore a hybrid in as little as 4 appointments. Today I want to dive a little bit deeper into that process, or what we call phase 2.
Sure. The Phase 2 is a master record gathering device, which we include in all our Synergy packages. It could also be utilized with any other surgical system that has a conversion prosthetic as well as a conventionally converted denture.
So what are the ideal records you need from the restoring doctor when you're ready for phase 2 to predictably be ready for the final in as little as 4 appointments?
Good question. The clinician will need to contact us prior to the patient's appointment, so we then can supply them with the proper scan flags for the case. It is important to note that at the time, the clinician must let us know what multi-unit abutment system brand has been used so we can supply the proper scan flags. The first appointment, the clinician will use these scan flags to scan the surgical conversion out of the mouth. Then scan the opposing and send Absolute those scans.
But I always get asked this question from restoring doctors. Should I do a second pickup during surgery or phase 2? What would you say is the ideal process to go to the final, and what would you say the pros and cons are for each process?
Another good question. Either way works for initial record gathering. If the restoring clinician does not have an intraoral scanner, then the pickup at the time of surgery is ideal.
Cool. Well, Jack, thanks again for joining me today and for your elaborate input on this process.
Thank you, Bushra.
And remember, it's not just the surgery, it's the smile synergy.